And we're very fortunate to have a family join us, Clint and Marcia Granberry and their daughter Sadie, who has been impacted by newborn screening. So I thought what we would do would be start out, and if you guys want to share with us your experience with newborn screening and a little more about Sadie.
All right. Well, as you can tell, she's very vocal.
Quite vocal.
Wow. We actually, she was 5 days old, and we had just got back from her pediatrician visit where we got great news, healthy weight, no jaundice, she was holding her head up, everything seemed wonderful. And we got home and immediately got a phone call from the same pediatrician's office that her blood work had come back and that there was a question. Before that, I honestly don't know that I knew newborn screening. I don't know that I knew the word, the term. I'm sure I heard it in pregnancy. You know, you hear so much, especially there at the end, and there's so much on your mind. And even in the hospital, I'm not even sure that I knew newborn screening existed. So I was terrified. And it was so bad that Clint had to get on the phone and talk to the pediatrician because I was hysterical. And you know, it's not good when they tell you, go to Children's and go immediately, go right now. It can't be good. Well, we got there, and when we got signed in, we started looking on an iPad, trying to find out any information of, you know, what this could be. And it was talking about how incredibly rare the disease is. We didn't get the results until Tuesday of the next week, so she was 9 days old when she began treatment. She's done well, has never rejected her formula or anything like that. But one of the things that we were talking about even on the way over here, one of the things that we saw in just researching PKU and newborn screening was the ethical question of, is it worth it? Because so many false positives are there. And you make these parents worry for days that there's something, quote, wrong with their child. And it comes back that there's nothing wrong, and you've stressed them out and worried them for all these hours. Sadie is an amazing young lady. She is far beyond what I could imagine. If it wasn't for newborn screening, I would still have an absolutely beautiful, perfect daughter, but she would not be the same person that she is. I know that there's medical, ethical, deeper issues than I could possibly begin to imagine. But just as a mom who, is obviously severely impacted by it every day, it's so selfish of me, or selfish to me, to think that there are people that would say, you know, it's not worth it, that... Well, watch it, sister. Say hi.
Hi.
Hi. Can you tell them your name? What's your name?
Sadie.
Can you spell it?
S-A-D-I-E.
There you go. Good girl.
What am I supposed to say? You're doing well. I second everything that my wife said. I work in radio and in the media, and I went to work that Monday and had to tell the guys that I was doing a radio show with that we had gotten this call, and
Siri not available.
I believe
Connect to the internet.
No Bible.
no Siri. And I actually had read the WMD, which I know is probably the worst thing ever, but I feel like the pediatrician told us to do this, and had discussed with them the newborn screening, and everyone at work, most of them had kids, and they didn't really realize, oh, it's the heel prick, and maybe they remembered that it happened, or a lot of times, you know, most of the people that we talk to Sadie about, they don't, even if they have kids, they don't necessarily know. They know, I guess there's so much going on when you're in the hospital that you don't realize that that's what's happening. But our discussion about whether or not it was okay to have parents wait for 3 or 4 days hanging on whether or not they got a false positive. And now it just seems so trivial and the most ridiculous thing in the world that I can't believe it's on the internet even, that someone would suggest that we shouldn't do it. So, questions, or I don't know where I need to take it next. I apologize.
So every year in Texas, approximately 800 children are diagnosed with a confirmed condition. And many, like your pediatrician, any one pediatrician does not see a whole lot of these conditions. Individually, they're considered rare conditions, but when we put them all together, they're not all that rare.
Right.
And so Sadie is a perfect example of why newborn screening is considered one of the most effective public health programs, and how it impacts the lives of children in Texas every day.
I would definitely agree with that. I have friends of friends of friends on Facebook that their children maybe weren't born in this country and weren't diagnosed until much later in life, and you can see the damage that's been done. And it's the day that when she was 9 days old and we got her diagnosis, and we were at Children's with the genetic specialist and with the dietitian and the nutritionist and her doctor and everyone in this dimly lit room. It seemed like the absolute worst day of my life, and it turned out to be the best day of my life, because if it wasn't for newborn screening, if it wasn't for us able to diagnose this, she wouldn't be here spelling her name for you. She wouldn't be, we've had amazing support from Children's, from everyone there, and just the positivity of it all, from the diagnosis, with clinics, with follow-ups, with anything. Just the positivity is huge, and it's been a blessing.
I would say that the scary dark room that where the first question is, are you guys related? Probably the most jolting of the entire experience. And obviously, and we've become such good friends with the girls that work in the lab at Children's, being there all the time, getting her blood taken 2-3 times a week for that first 6 months to a year. And a girl up there by the name of Chris, her explanation of her perception of our first day there on the Friday when we had just received this news to get down there and get her tested, and we're frantic, and everyone else is going about business as usual, and her her perception was that Mommy doesn't know what's going on, Daddy over there with his iPad out trying to look up some stuff. And then after going to Children's as much as we did and realizing how blessed we were, and it really, you start to understand that, your situation's never as bad as you perceive it to be. And, there's so many other people there that are in so much more difficult situations than we are. And, we've had the discussion about always going in there with a positive attitude and trying to be strong, not for ourselves, but for other people who are, just like us, that may have just gotten that call, that may just be walking into the hospital and have no idea what to expect. And that, as long as we could project that, it's going to be okay and you can overcome anything, that's a big part of our story, that we've really tried to be a good example. And as you can tell, those of you who have met her,
She's a handful.
She's a handful, but her vocabulary's through the roof, and her personality's through the roof. And yeah, just like Marisha said, I can't even imagine not being in a position where we would have known how we could help her. And I have since, after the fact, know some people who are my dad's age, or that maybe their kids were not screened. And, you know, if you see pictures of someone and you can tell that a child has special needs or whatever, and it makes me wonder, you know, those black and white photos, and it makes me wonder, well, how many of those kids, they just had no idea. And I don't know that we would ever know if, you know, they necessarily would categorize a kid as having PKU after the fact or whatever, but to be thinking that we would have been feeding her something from day one that was hurting her blows me away. And we can go back and look at the videos that we took of her at the house, and it's weird. Like, I can tell now. I could tell that her levels were really high. I can like see it in her eyes, you know. But I didn't know any better, you know. To me, she was still perfect, beautiful, but I could tell. And to think, I can't even imagine, to think that, you know, that we would be, here, baby, just have some more milk, or, you know, how about a little piece of steak? What a crushing blow. And like Marisha said, these people that live in South America or some of other undeveloped countries where they're not doing pre-screens or newborn screenings, I can't imagine what that feels like to them, to go 8-9 years and cognitive ability never get past a certain point, and then to bring them to the United States and they get tested and it's like, oh yeah, yes. I can't imagine what it would be like to think, oh man, this could all have been prevented. And I think that's the most amazing thing about the program, and the awareness of what's going on maybe should be higher. You know, I think the more families that realize why their baby's foot or heel was pricked for blood would really, I think, raise the awareness of what we're looking for. But the amount of parents who, you know, you never get a response for that kind of test, or everything comes out clean, and you don't think about the importance of it to someone who it really, saved her life, and really saved ours in a lot of ways. Say something, Sadie. We told her yesterday that we were coming here to talk to doctors, and her response to what the doctor said.
What did the doctor say?
He's jumping on the bed.
Because of the No More Monkeys Jumping on the Bed song. So, if you are a physician and you talk to Sadie, be sure to tell her that there's no more monkeys jumping on the bed.
So, as parents, when would you have preferred the discussion to take place about newborn screening?
Honestly, I wish that even in high school health classes, there was more discussion on it, because then at least you're not going to be knowledgeable on every rare disease that screens for, but at least you know what the newborn screening, what it is, what it could possibly mean, that it actually even happens. I think during pregnancy, it was probably brought up, you know, in the third trimester, and I'm sure that there's ethical reasons for that as well. But even maybe if it was touched upon every trimester, just as a reminder and to show the importance of it, even if it comes back or you never hear anything. Because I have a 20-year-old daughter as well. I don't remember newborn screening. There was not an issue with her. So you don't hear anything, you don't ever remember it. You've got so much other stuff going on in your mind with a newborn. I just really wish that it could be discussed more so that the importance was raised.
And I would say that the weird thing is that we thought she was fine, because you hear the whole, 10 fingers, 10 toes, everything came out great, And literally that's what I'm thinking as they are laying her on that table for the first time, and I'm like looking at the nurses, and is she okay? Are we good? And then to be in that position and then not know, I guess maybe that, oh, well, there could be bad news coming. And so maybe that would have helped me initially to not think, well, hey, we're in the, we're out of the woods, we're all clear, we're good to go. And then to get the phone call and be like, whoa, what? I thought everything was fine. And again, I think that's just a part of not being educated enough as to the process and how long it takes to get, those initial results back. And
No.
One of the things that we've been discussing at this conference is where newborn screening is going, and Dr. Powell gave us a wonderful talk about the possibility of maybe in the future doing whole genomic sequencing, which is looking at every base pair DNA within the genome. And as parents, with a child who does have a condition that's been detected by newborn screening, we were hoping you might be able to comment on your thoughts about that.
are you saying looking for issues prior to birth? Is that what you're?
Okay.
So what we're thinking about is being able to expand the number of different conditions that we could detect through newborn screening compared to, the fairly limited number now. So in addition to, some of the metabolic conditions like PKU, to think about maybe conditions that might cause, other problems in children with an early onset that might, be treatable, but could affect, their development or their, risk of developing a cancer or a heart problem, expanding to things like that. And I think, I'd be curious to know how you would think about that, having had a child, who successfully was, had her condition picked up through newborn screening.
Yeah, I would think that as much as could be detected after the fact would be a great benefit. The test for Downs and what have you that they do in utero, like, we didn't care, because we were going to have or whatever, so we didn't. And, the amount of false positives on that test as well. But after the fact, after they're born, if there's anything that you can get a jump on, or at least prepare yourself for, mainly because there's so much information and stuff to take in, and books and podcasts about babies, and how to even, what you're supposed to do with them.
I would so agree with that, because I think giving people the opportunity to educate themselves as soon as possible is a huge benefit, because I still can't say what PKU, the real word for it is, and please don't tell me, because I won't be able to repeat it again. But thank God that there's PKU, because that's what we call it. But there's no way I knew what that was. There's no way anything. In the past 2.5 years, we have educated ourselves a lot on food, on different amino acids, things that I should have paid more attention to in school. But
especially if some of these conditions are caused by maybe like the diet of the parents. If we learn that the diet of the parents ends up causing a child to, maybe we see developments of some sort of an issue. If the education is there, then maybe the parents would take into account, like, hey, we shouldn't, maybe you shouldn't be doing this or shouldn't be doing that. But instead of having to catch up after the fact, learning about it on the fly, like while you're just dealing with having a newborn, knowing about the possibilities of some of the things that you could be looking for, and the amount of diseases or issues that a child could have, it seems to me like the sooner the better, like that. And that just makes sense. That's, that seems completely plausible. And I would even say, if I knew that there was something that you could tell me about my child the day that she was born, tell me about it. It may not be the news that anyone wants to hear. It's not, it's never, that day when you're being asked if your relatives is not the day to get your opinion of how you feel about it. It's certainly overwhelming, and it's going to be no matter what. But again, the ability to inform yourself and educate yourself, I would think that most people would benefit from that. opportunity as soon as possible.
And how would you feel if the newborn screening detected a condition that wouldn't affect her until she was an adult?
I'd still want to know so that you could be able to prepare for it. Again, it's all about educating yourselves. And I think a lot of the attitude that you have towards whatever issue it is, if say that this was an issue that didn't affect her until she was 20-ish, and you know she could eat whatever she wanted to now, but then she couldn't. If it was something that was degenerative like that, that maybe the enzyme just stopped working at a point, being able to be positive about now, and whether if we chose to start the diet now, and just the education and the positivity, and to be able to know that and to prepare, I think would be beneficial.
Now, I'm assuming that at some point with medicine, we're going to get to a point where we can tell, hey, when you're 50, you're going to develop, breast cancer, what have you, and there's not really much we can do about it until then.
I still want to know.
I think there's plenty of probably sci-fi movies about how to deal with that ethical question of going through your life knowing that that's coming and what the end will be or whatever. But I would look at it in terms of it's something that you don't necessarily have to prepare for, but if we could tell that a child was going to develop autism or be autistic or any number of issues that are going to affect them in their stages later in life, again, with the education, the strides that the medical community has made in something like PKU, even just in the last 5 years, is amazing. And the one thing that I would look at that as like gives you an opportunity to be an advocate for your cause, whatever that cause is. And again, the raising of awareness to the public, because they don't see these small groups, the small, I hadn't been in children's hospital, until that day. And it's such a big place and it's so important. But still, if it's not in your minds, you don't really think about it. And to be able to, again, inform people of the importance of whether it's diet or whatever, I would think that would be.
I can't think of a reason that I would be
No.
opposed to any screening, any detection. I'd want to know anything that you could tell me. I think would be a huge benefit.
I actually, I had a hard time at first initially telling anyone that there was anything wrong with her, because there wasn't really anything wrong with her to me, if that makes sense. And Marisha's always been the one that was more out front and joining the Facebook groups and talking to other parents, and I'm much more day to day. But, there is a PKU Awareness Day, and I was actually having a conference call with a national radio show that I was working with at the time, and it was the first time to just a random group of people that I know, especially that I know professionally and don't know personally, that when they circled back around to me and asked me if I had anything else, I was like, oh, hey, by the way, today is PKU Awareness Day, and here's what PKU is, and my daughter has PKU, and so today's PKU Awareness Day, and now I made you aware. And the next day, one of the guys that hosts the show actually had adopted a daughter who had PKU, and it was not treated. And she's 15, 16 now, and will be kind of in that perpetual childlike state forever. And it's something like where, to me, I was kind of holding back again, not wanting to take, I don't want to tell you anything's wrong with my daughter, because I don't think anything's wrong with her. But just in, again, mentioning the Awareness Day, now I know someone who is influential and, who is directly affected by it every day of his life and will be for the rest of his life. So again, the awareness to the issue, I think would be beneficial. I thought that was pretty cool.
I could say you guys are great advocates.
Thank you. She's the advocate. She's the champion. Again, my uncle, I'm from East Texas, and I have an uncle who literally lives on a lake in the middle of the woods, in the middle of nowhere, and we went by to, over the holidays after she was born, and when Marisha was trying to explain to my aunt that, you know, she has PKU, and my uncle chimed in with, ain't nothing wrong with that baby. And that's kind of been our motto, our rallying cry. Yes.
Dr. Carlin, did you have any thoughts about expanding newborn screening to genomics?
Well, I thought that the presentation actually, that's not answering the question, but I thought it was excellent because it allowed us to sort of think about it in an organized, deliberative sort of way, and then at the end to sort of think about the areas that are a little bit more controversial perhaps, or where people might have a little bit of a difference of opinion about what to do in terms of interpretation. But certainly I think that as we get more information, especially from projects like yours, where it's not, so you're not going in with a kind of preconceived notion, you're really looking at it correctly, that we will probably decide what part of it makes sense and where to go, and it'll be on its way with some thought.
Do we have any questions from the audience? Are there? We haven't tired you out yet, have we?
She does.
I have a question for the family, somewhat unrelated to the expanded newborn screening, but I assume that the question about whether you two were related to each other came as part of taking the family history, and I assume that, yeah, like walk in the room, yeah, are you related? Hopefully not. But
The lady who asked me that question is in this room right now. I see you.
So I work at the University of North Carolina, and we do a lot of the newborn screening follow-up and follow many patients, pretty much all the patients in North Carolina with PKU. And it comes up a lot because we have, you know, excellent genetic counselors who become involved with the families, but also our metabolic dietitians. And so when we have a new patient, a new child diagnosed with PKU, and, you know, we're talking to the family for the first time or first couple of times, you know, it seems that there's so much information that you need about, you know, what PKU is and how we can treat it, and the diet and the, you know, formula and protein and all that, that sort of the genetic counseling piece gets delayed somewhat, you know, because we don't want to kind of push too many things on our families at the beginning. But do you have any advice about what would be the good timing of that, so we don't sort of forget about it, but maybe so you're not, you know, presented with it necessarily right at the beginning in terms of the, you know, genetic risks, recurrence risks, things like that for regarding PKU?
Well, I would say that, again, with the too much information thing and the internet, and I specifically remember looking at a video of a person on YouTube that was an adult who was affected by it, and it freaked me out. You know, if you want to find the worst thing possible, Google something, you know. And actually, one of the things that they did at Children's, that was one of the first moments that we were, it was live and in person, getting to meet another family with a little girl who was 5 or 6 and completely normal, and to see the family and them, you know, and they kind of, to see they're normal and that know that, okay, we're going to be okay, we're going to get there. I don't necessarily know if there's a good time to ask you you're related to the person that you're with, or
The funny thing is that my family's from East Texas as well, and his family's from East Texas, and it was always, I thought I was being funny of, well, we can never go to each other's family reunion because we'll know people on both sides, somehow we're related, ha ha, he he.
I
And
never
then
thought that was funny.
I thought it was hilarious. And sitting in that room, and we were both bawling and crying, and Donnie's just looking at us and doing our family charts, and she just looked at us and said, "Is there any way you could be related?" And I'm sure I had a horrible look on my face, and because she looked back at me
I
like,
think
"What
you
did I
turned
say?"
and looked at me. I think you just
And
gave
Clint's
her-
like, "Oh, she's always joked about that. We're not." But going back to I don't know how any other place does it other than Children's where we are, but they stressed several times during that day, which seems like we were there for about 72 hours that one day, but it was the longest day of my life. But it seemed like there was a lot of information that was given, but there were breaks given, and also we were told several times by several different people, you're kind of in a state of shock right now of the information that you've already received. You are not going to be able to retain everything that we're telling you. And I remember thinking, you don't know me. You don't know what I'm going to retain. I'm already, but roller coaster emotions. Plus I just had a baby, a little bit of slack, but a lot of handouts were given to us as well. Whenever, Donnice, whenever our genetic specialist was telling us something and explaining it to us, we also got a handout. That was very great because she put it in a folder, and I believe she told us, you look at this next week, in a couple of weeks, whenever you're better, whenever you've come to grips with it, whenever you're okay with it. And it's okay that you're not okay right now. And honestly, that was amazing because we kind of got to do it on our time. And it wasn't like it was brand new information that we couldn't comprehend because we're not as educated as you ladies are. But it was stuff that, I do remember her saying this, and then I could go more in depth on it. So I thought that was great.
Denise, do you have any comments?
Sorry.
We'll get you the mic.
Oh.
Sorry. So we know that first day is overwhelming. We have lots of families who have given that feedback, and when they talk to panels say similar things, but we're always trying to balance the fact that the families have a right to the information, and if you decide to withhold something at that first visit, and yes, you might plan to talk about it later, but then the same thing someone was talking about earlier, if you don't do it now, are you going to have an opportunity later? Hopefully you will, but what if you don't? So we're always trying to balance that. I hope in general that it's not too traumatizing of an experience.
No, but it's important for you to tell us how serious it is, because I would imagine that there may be cases where people don't necessarily, it doesn't register. Or
that sentiment of there's nothing wrong with that baby
Right,
is a great
exactly.
thing, and you're right, there's nothing wrong with Sadie. She's perfect.
Yeah, if there's people that think that we shouldn't give vaccines to them,
Right.
And so it is important for it to be sort of scary, that it is a big deal, and that it should be, we're not joking around. And I totally get that after the fact. It's really important so that someone doesn't walk out of that room and just and throw the packet in the trash can and go home and, serve them up Bluebell or something. And so I was thinking about this on the way over here. There's no great way to deliver bad news. If we weren't in a darkened room because of the urine test, what are you going to do? Text me? I thought about, because she was screaming when we got the phone call on that Friday. Clint, something's wrong, Clint. And I remember, number one, how traumatizing that was for me to have her running in here. And I'm like, whoa, let me call someone and find out what's going on. But again, what are you going to do? You know, you're going to have to call, and you're going to have to make that, you know, there's no buffer. There's no way to make that easy. If you get a cancer diagnosis later in life, it's going to be delivered. And again, I would rather be in that situation with people who, if we did freak out, could help us than, you know, us to get a text message from a number we don't know and say, hey, by the way, your kid has PKU, so good luck with that. So while that's difficult, there's no other way to deal with it, you know. Bad news is bad news, but again, I think it's best to get a lot of that stuff out of the way up front, especially the seriousness of it. While it may not be easy to hear, it still needs to be heard.
Being a parent, when do you think is the best time for the parents to be educated about all this neonatal screening? Like, you know, during the delivery, or maybe the prenatal visit of the parents to the pediatrician, or when?
Yeah,
I
think it would have been, again, nice to know that, hey, there could be more coming. Not just, again, because I looked at it like can I get the thumbs up from the doctor and we're good here. If I would have been educated in terms of what they do, I don't recall, and we went to a great, you know, we had a great team that we saw during our pregnancy, but I don't recall that ever being discussed.
If it was probably in the third trimester at the end when there's so much other stuff.
Or in a packet, maybe, you know, maybe we should have, you know, but it wasn't, I don't specifically are ever coming out saying, hey, this could be something.
No, I would really, you know, looking back, and of course, as much as it's affected us, I would think that it could be touched upon, even if it didn't go into great detail. I mean, even at that first, hey, you're pregnant, that's great, here's your due date. By the way, here's some information on newborn screening. This is going to happen and that may sound silly, and all of you obviously are impacted in one way or another, but for us, even if I was given that day, that would be awesome. And then maybe an appointment in the middle of your pregnancy. Here, we gave you that packet, here's the information. These are some of the things that it screens for. It's nothing terrible. It's not, a death diagnosis, but you need to be educated on it. And then closer to the end of pregnancy, hey, don't forget, when you're in the hospital, you're gonna have so much on your mind, family, friends, people coming in, Facebook updates, all this is going on, but you're also your baby's heel is gonna be pricked, and there's gonna be blood taken, and in a few days, you're gonna get results. No news is good news. If you don't hear anything from us, you're fine. But if you get those results, at least you know that it's not traumatic. It's not the end of the world. It's nothing negative unless you make it something negative. It's not. And I think throughout pregnancy, to shorten that answer, I think throughout pregnancy, just touching on it, just education.
Do you think if you were given a little bit of a leaflet about neonatal screening from Texas, about just a general idea about what it is during your third trimester, will you read it, or will it be beneficial?
I would have definitely read it. I read everything. I was 37 when she was born, so I was already high risk since I was over 35. So I read everything that I possibly could. I knew that I was at higher risk for having a baby with Down syndrome because of my age. So I don't think that I was completely ignorant to all the facts, but I definitely wasn't as educated as I should have been on the newborn screening.
Thank you.
Thank you. Oh, what's that? Oh, that's Mommy's. That's Mommy's. It's Mommy's.
One of the other things that we were talking about earlier on was testing for carrier status. Since you have a 20-year-old, do you think, I think one of the conclusions was that it was not worth it to test before they can start reproducing. But as parents, do you think it would be better to do it as early as possible?
I would say as early as possible. My older daughter, Sasha, and I have had this conversation, and she definitely does want to be tested to see if she is a carrier, just because, and she's obviously more educated than I was at this point. But yes, I definitely would want her to be tested if it's available, because it could be something, she could be more educated going into her pregnancy. If she had that information and she chose, because of that information, not to go through a pregnancy, I think that we need to give people that information so that they can be educated before they decide to have a family, before they decide to go into pregnancy. I don't think that there's many options where education is a bad thing. I think knowing as much as you can about yourself, about your family, about your genetic history is important.
So there are some populations about carrier screening that have been active in population screening for those populations, such as the Ashkenazic Jewish population, in screening for conditions that are more frequent in those populations, such as a neurodegenerative condition known as Tay-Sachs.
Mm-hmm.
And they've approached it in a variety of different ways. The community has bought into it, and there are sometimes mass screenings, and there are some foundations that will help fund the screening. And there are some very Orthodox families in whom the marriages still are arranged. And what they've done is there's an organization that will screen you for the conditions and just won't set you up with somebody else who's a carrier. But they will never release to you exactly what you're a carrier for. And all of those young ladies and young men go into clinical care and then request screening to find out what they're carriers for. So it was a way not to be pejorative, because there was concern that if a family was identified as a carrier, that would make their other children less marriageable and less within that community. So there are some models out there about screening for carrier status, but generally that's for populations that are at a fairly high risk for those particular conditions. And one other thing that I wanted to share with you, if you think you were shocked, the Texas Newborn Screening Program, sometimes we detect a baby who has an elevated phenylalanine, but it's not high enough that they need treatment, and it's in benign hyperphenylalaninemia. At the age of 11, we send them a letter to remind them that the baby did have a high phenylalanine level, because during pregnancy, those levels are even higher in the fetus, and it can cause damage in the developing fetus. So if you think you were shocked at age 11, you get a letter from the state saying, guess what? You're at risk. And we had a long discussion about the appropriate age to send that. Initially we were sending them at 14, when they turned 14 and 15, and then unfortunately there were a number of teen pregnancies, so we kept edging it down lower and lower and lower. And we actually got a call from a parent that was outraged that we think about their 11-year-old thinking about having babies in the future. So, right. So, we don't really have much follow-up on that. We don't know what happens after that letter goes out, aside from when they call annoyed about something. That's generally when we hear from folks. So, there were some more questions out there that we saw. I guess we've answered them.
I just wanted to ask him about, I talk pretty loud. I wanted to ask you about your relative in East Texas. Do you have any problems with them and the diet that you have to give her? Do you have any problems with them criticizing you about the diet?
Oh, no, ma'am.
Okay,
No,
good. I wondered about that.
No,
Because
ma'am.
relatives can be kind
Right.
of strange sometimes.
Right. No, they can be strange quite a bit of the time, for sure. No, we're upfront about the funny thing is now, Sasha worked at a school that, was a peanut-free zone. There's such a hypersensitivity to kids and what they're eating, and because I was afraid of the sharing thing. I'm thinking about when I was in elementary school and we had our snack time. I do remember the kid who had like diabetes who got to have something, and thinking then that like, man, those kids are getting crackers right now, and I don't have crackers. It seems like it's not as difficult to be like, hey, we can't share our food. You can't have the Haagen-Dazs ice cream bar. We've got our own. And yeah, most of our relatives are just as up on it as we have been now, and nothing else. We stay on them about it and try to monitor them as best as possible. Boy, she does. Boy, does she.
Any other questions or any other thoughts?
I'm sorry that I have to ask this. I'm also sorry if this is going to offend anyone, but with the people that are in charge of the state, I worry about some of this stuff. Is the newborn screening, is there not a situation where that would be taken away?
No.
Okay, you have to ask because we have a guy who's been in charge for a long time and thinks he's king of this place.
Yeah.
And unfortunately, health services doesn't get as much attention as possible.
Actually, we're expanding.
Okay,
the
great.
Screening, so.
It's good to know.
And as of September 1, babies are going to be screened for, it'll be required by the state that babies be screened for critical congenital heart disease by taking a measure of the oxygen in their blood, just what's called a pulse oximeter. Just put it on their skin and measure it in 2 spots. So that's going into effect on September 1, and then sometime in 2015, we'll be screening for what's called secondary conditions, which are conditions, they're metabolic conditions that didn't quite make it onto the core, what we call the core panel, but are detected through screening for conditions on the core panel. Some of them don't have effective treatment. Some of them are just as critical as conditions on the core panel. So we'll officially start screening for that sometime in 2015. That's awesome. So the answer is no, we don't think it's going away. About half of us in this room would be out of a job if it went away. So we're hopeful that it won't be going away, but we've had absolutely no indication. And as difficult as the state can seem, everybody feels good saving babies.
Yeah, hopefully.
Once they're out.
Right.
There's a question back there.
When the changes come in 2015, who will determine what will be disclosed to the parents?
With the expansion of we have full disclosure, anything that's up until now. So we adding the secondary conditions to formally screen for them in 2015, but a number of them we've been able to detect during screening, and we report those out. So whatever we see is reported out, and it's followed up on. We may not have maximized our screening to pick up every child with those particular conditions, and with formal screening, that's going to be maximized within both the laboratory setting as well as clinical care coordination. So there's no withholding. Anything that's found is reported. The newborn screening lab is a CAP and CLIA approved lab and follows all of those regulations. So there's absolutely no withholding. Whatever's there is reported. Now, the program reports to, the laboratory report goes to the submitter, whoever submitted that, and our first contact is with the child's primary care provider, if we can find them, so that we work through their medical professionals. The family already sometimes has a relationship with that provider and makes it easier. Sometimes the baby's still too young to have even seen their pediatrician or their family practitioner, whoever's going to care for them, and we try and hook them up to to find a primary care provider and find a medical home for that child. So, and then if that fails, if we can't do that, then we will talk to parents directly to ensure the safety of that child.
I think she might have been discussing the second generation plan.
Yeah, that you're not gonna do
The ones we were
whole
discussing
exome.
about.
Oh, we don't do whole exome sequencing. They're exploring whether or not that would be a good thing to happen, essentially. So there are lots of projects like Dr. Powell's. There are 4 of them that are now exploring different aspects of whether we should and how and what the issues are and if it's done the best way to do it in terms of sequencing. Now, the secondary panels are different than the sequencing. That's a whole different scenario. Those are, the secondary panel are discrete conditions. Most of them are picked up through the mass spec. It's called MSMS screening that's used for the primary. So it's not going to be additional testing that's being required. And right now, none of the secondary conditions from the state perspective will have a DNA test associated with them.
What is the cost of newborn screening as it is being done currently?
All right, it's $33 and change. Karen, do you remember the exact amount? $33 and change. Per screen. So it's a bargain.
Okay.
Sadie, did you want to share something with us?
I think we need to take a break here.
Yes.
Okay, be right back.
Okay.
Be back in a minute.
Sorry.
Well, no problem.
Excuse us, please.
If you guys want, we can call the panel now. If nobody has any other questions, the reception will be outside of these doors, and please stay. We do have door prizes that will be available, and we'll try and get that going. I think they were expecting us a little bit later, but we'll check out front and hopefully get that going a little bit sooner so you guys can enjoy your Saturday nights. So thank you all for coming. And I have to say, as a New Yorker, I finally learned to say y'all. So thanks, guys.